Latiya City Expats Club is a non-profit social organisation and our speakers are volunteers. The club as such assumes no responsibility or liability for the professional reputation of or the quality of services provided by the speaker today.
We have a special treat. Wait for it, wait for me, wait for the intro. Pause. All right. In our audience, we have Barry Upton, local legend, music creator. If I start on his bio, it's just going to go on for too long. But he's written a wonderfully tongue-in-cheek song about the Olympics, and winning is the only thing. And the more I look at this, the funnier it gets. So I just realised it's very tongue-in-cheek. So we thought we'd kick off with this. So let her rip, Skippy.
Second on the cup. It's the winning that counts. That's what it's all about. Hold up the gold and shout. It's the winning that counts. There's no point at all in only participating. You'll never be a winner till your whole damn body's aching. 'Cause it's the winning that counts. That's what it's all about. So hold up the gold and shout. It's the winning that counts. Yeah, it's the winning that counts. It's the winning, it's the winning. That's what it's all about. It's the winning, it's the winning. Hold up the gold and shout. It's the winning, it's the winning that counts. No pain, no gain, no medal, no fame. Nobody's gonna even remember your name. If you're not there standing on the podium, you might as well have stayed right back at home. So you better get ready and steady up for the race, 'cause you're gonna be Mr. Nowhere in second place. 'Cause it's the winning that counts. That's what it's all about. Hold up the gold and shout. It's the winning that counts. Yeah, it's the winning that counts. It's the winning, it's the winning. That's what it's all about. It's the winning, it's the winning. Hold up the gold and shout. It's the winning, it's the winning that counts. Hold up the gold and shout. It's the winning that counts.
Round of applause for the song, Mr. Upton. Take a bow. I think actually the club can take a bit of a bow. Barry was here a few weeks ago, and who was here when Alexandra performed, and she did some duets and stuff. She's so wonderful and charming, Alexandra. And Barry was in the audience, and now he's doing some duet gigs with her. So So that wouldn't have happened if he hadn't turned up on that day and Alexander had been performing. So a little bit of a pat on the back for the club to stitch people together, expats helping expats and bringing them together. So today, of course, also, who was here last week for the talk on Myanmar? It was everybody learnt something. You know, you mightn't have agreed with the whole talk, but everybody came away knowing more about Myanmar, including my Myanmar partner, Rose. So it was a really quite amazing talk. We couldn't get it up on YouTube this week. I have to go through it and edit out references to Thailand. So, because there were some references to Thailand, so I'll cut that out, and highly recommended that you listen to the talk because you will learn something about Myanmar. So today we've got two people from Bangkok Pattaya Hospital. Dr. Parinya is one of them. He's going to be talking about heart health, how to keep your heart healthy, and we're going to do some sit in your chair exercises to help strengthen your heart. And then we're going to have some Howard's going to step up to the plate and do a survey about what you'd like out of members' meals that we have once a month. Now, as I say every week, the most important thing, switch your phones off or to vibrate. And that includes me. All right. So I've just got to go out and usher the speaker in. Hey, John, good to see you, mate. And I'll just talk among yourselves, okay? And this is Dr. Parinya. Round of applause for Dr. Parinya. And it's always a great privilege. You don't realise it's a big deal to these doctors to give talks. They don't give many talks in public. And you go into their offices in Bangkok Pattaya Hospital and you'll find that the plaque we give them, thanking them for their talk, is up in their office. So it's a very big deal, okay? And they're extremely highly qualified. They have qualifications not just in Thailand but overseas. And that's a very big deal because most hospitals don't. They have locally trained doctors, but like Dr. Parinya, you spent time overseas. Which countries were you in?
I learned in Thailand and some course in America.
Yeah, see, this is a big deal to be trained overseas. So, anybody who has a heart, listen up to the talk, okay? I'm going to hold it close like this.
Okay, come. I start.
Yes.
Okay, come. Good morning, ladies and gentlemen, everybody. Okay. Today I.
Sorry, interrupt you. This is if you want to operate this yourself. This is the laser, and that's
this.
Forward and backwards. Forward is down.
Okay, thank you.
Sorry.
Okay, today I talk about how to keep your heart healthy. Okay, this I talk about the condition that make your heart healthy before you turn to be a big heart problem. Okay, this first you need to understand about your heart healthy. Okay, this because most of heart problem. Okay, this like a high blood pressure and also high cholesterol, high sugar too. This from WHO report, and 1 in 3 of adults have a high blood pressure, and 4 of not adequate treat. That means sometimes take medication but cannot get the blood pressure down to the proper level. Okay, and this is predicted by WHO that if can control everybody that have a high blood pressure, we can reduce 76 million people dead in about 27 years, next 27 years. Okay, next this is avoid about something that harmful about your habit. Okay, because the risk of the heart problem, brain problem, and cardiovascular problem is 5 main factor. About first is behavior factor, like this quarter, okay, have a 1/4 have a protein. Protein need to choose about our rice is better because it have more vitamin, more fiber, slow absorption, and half of your plate is mixed between vegetable and fruit. About vegetable, okay, you can eat many vegetable and fruit. Okay, this is less. Less sugar and sweet fruit is better. Okay, and about your snack. Okay, when you choose a snack. Okay, this is recommend, but you can choose the other like maybe half 1 cup of a non-fat yogurt, or maybe sometime like a non-fat milk. Mix with about fruit that unsweet fruit, okay, or maybe mix with a nut, or this is hummus with vegetable, okay, like a snack. Okay, and about this is need to avoid, but okay, there's empty calorie is like processed food, like about sometimes you have this like a snack, but this is have a lot of fat, trans fat, or sometimes have a lot of sugar and sodium too. About sugar, normally when you eat in your dish have a sugar already, but you need to be careful about when you mix more sugar. This is the amount of sugar that you can mix for women, less than 6 teaspoons, and for men less than 9 teaspoons. Alcohol, okay, alcohol you can drink, but you need to drink not too much. Okay, this is amount of alcohol that you can drink. Okay, if you drink wine, it's just only 5 ounces a day. or beer is just 12 on, and liquor is about 1.5 on a day. And cocktail need to be careful because it's mixed with many things that have sometimes high alcohol, sometimes high calorie. And another one is a cut sodium because more than 75% of sodium is mixed in your diet already. And when you mix more sodium, it's like a sodium overload and make your workload to your heart, to kidney, have a congestion, have a high blood pressure. Okay, this next is regular health check. Okay, when you check like an annual checkup, what you need to do, just this I list just some tests that should do every year, but some people need to check more up. It's like an individual. Okay, this electrocardiogram first to check about your heart wave, to see heart rhythm, see about pattern of heart damage or heart attack before, because in some condition like diabetes, 25% of diabetes have a silent heart attack, like a no chest pain, no symptom of heart attack, but like a late symptom from worse of heart pumping function and turn to be heart failure. X-ray to see about your heart size, see your lung tissue. Blood test. Annual blood test like a blood cell, blood sugar, hemoglobin A1C. This is another one that check average sugar control in 3 months. Cholesterol, triglyceride, HDL, this good cholesterol, and LDL, bad cholesterol, and kidney function. And exercise test in some people that have risk like a high blood pressure, diabetes, chronic kidney disease, or sometimes have a symptom on and off. Okay, this you can choose an exercise test or an echocardiogram to see about heart pumping function, heart valve condition. CT, coronary calcium score. This is the add-on test when you like to know about your status of your heart artery, because okay, I show you the picture later that what is calcium on your heart artery and cancer screening. Okay, this is an add-on test. If you have diabetes or hypertension, every year you need to check more tests like protein leak in urine, because protein leak in urine when it's high, that means small tube in the kidney is not working well and like have a hole, and it can be cause of leak out of protein into urine, and can detect by this test. When you have high level, that means you have a risk of a kidney problem higher than normal people. And eye and feet examination. For your eye, doctor see about your lens, your retina, and the vessel inside your eye, because this is related to high blood pressure, high cholesterol, and high sugar. It can be cause of damage of your eye vessel and nerve inside quicker than normal people. And feet examination to see about circulation and the nerve function. And also ABI, this is another one that check about circulation by the check the pressure of both arm and both leg together at the same time, and see about ratio of pressure of both leg. If you have a low, that means circulation of that leg is not good. Okay, this This diagram from American Heart Association, and this is check about some people that never have a heart problem or stroke before, have a high blood pressure, or sometimes no high blood pressure, no diabetes, and have only high cholesterol. When you have blood test, annual blood test already, you need to put in formula that can calculate about percent like this. This is calculated by a special formula from American Heart Association, and also European Heart Association have a formula too, and calculate in the different diagram, but the same pattern of the risk. And when you have a high risk, okay, you need to be careful, because a high risk can be turned to be the heart problem, brain problem too quick in less than 10 years. And when you have a risk high, okay, you need to get bad cholesterol down, lower than medium risk and lower risk. Sometimes when you have a medium risk, but you have the other component, okay, this maybe cannot see, okay, I explain. This is a less enhancer, like when you have a kidney problem, when you have a high bad cholesterol over than 160 for many years, or you have a high triglyceride many years, or you have the other immune or connective tissue disease, okay, you have a chance to be a problem with the vessel higher than other people. And sometimes if you have a medium risk for the heart problem, your doctor advise you to check some component, something that could be mixed together and have make you have a quicker problem than normal people. And if you have a risk enhancer, your doctor will advise you to control by diet control and maybe plus with a medication, most like a statin. Okay, and this is a picture of a calcium score, because calcium score is easy to do, less radiation. It's do like a CT scan of your heart, but not inject contrast, just early step scan. And when after scan, you can see about the calcium, like this is normal. And this you see the white shadow, and this is more and this more. This is a component of calcium that mix inside the plaque. When you have a bigger plaque, you can see more calcium in the tract of your heart artery. And when you see a lot, because it's calculated by score by the machine. When you have high score, that means you have a lot of plaque volume and have a higher risk to be a heart attack in the future. Okay, this Thai language. Okay, this now Bangkok Hospital do this heart preventive program to make everybody healthy and live longer. Okay, come.
Thank you, Dr. Parinya. That was extremely condensed amount of amazing information to take in. Sorry, I'm trying to. Yep, Kanakwam. Is Kanakwam ready to give the exercise program now? Yeah. Okay, you sit down, Doctor. We'll get you up later for a Q&A, but first we're going to do the exercises. And I've got to stay down here and be a ringleader, and George is going to join in, and yeah, you are. You know you are.
I didn't volunteer for that, my heart.
I just gave him a mild heart attack then. Here we go. We've got a whole team of people. Have a look at the height contrast here, right? By the way, I heard a really good joke today while they're getting set up, but it's probably... Anyway, I think it's a true story. Actually, one guy said to the other, I said, I think my best friend John is having an affair with my wife. And he said, what makes you think that? He said, he seems really miserable lately. Hello, this is Kana Kwam, and she's going to... Sorry? Not you. Go away. Sorry. This is Kana Kwam, and she's going to lead us all in some exercises on the sitting down, which is going to be right. Kana?
Good morning, everybody. Today,
This is Kunjis, who's taken over from Tanya and organises the speakers now for the club and everything. Thank you so much, Kunji.
Today we will have a chair yoga. Chair yoga is a gentle form of the exercise. We can exercise while sitting on your chair. The main benefit is to reduce the impact on your joint. Yes, sure, it is specifically designed for the young people like us. And other benefits is to improve flexibility, reduce stress, help manage pain, or help lower blood pressure, improve balance, prevents depression and anxiety, and improve circulation. One is overhead stretch. Everyone ready? Okay, thank you. The first one is stretch your arm. Stretch your arm. Here, like the first picture. Stretch your arm. Down. Stretch your arm down. Then upper your arm. Upper your arm. Breathe in and hold it for 5 seconds. 1, 2, 3, 4, 5. Okay. Down. Breathe out. Don't forget to breathe out. Breathe out. 1, 2, 3, 4, 5. How you feel? Better? Wow. Healthy. Healthy suddenly. Okay. One more time. Okay, lower your arm, upper your arm, breathe in 5 seconds. 1, 2, 3, 4, 5. Okay, lower it, breathe out. 1, 2, 3, 4, 5. Okay, very good, students. Okay, the next one. The next one is neck stretch. Okay, sit straight and then left, right. Put your right hand on your head. Put your right hand on your head and tilt your head. Tilt it. Hold it for 5 seconds. Straight. Hold it for 5 seconds. 1, 2, 3, 4, 5. Okay, go to normal. Go to normal. And then switch side. Tilt your head. Breathe in. 1, 2, 3, 4, 5. Back to normal. Breathe out. 1, 2, 3, 4, 5. One more time. So you can memorize this, then you go back home. Okay. 1, 2, 3, 4, 5. Back to normal. Breathe out. Switch side. Switch side. Tilt your head. 1, 2, 3, 4, 5. Okay, breathe out. Thank you for music. Next one. Chair warrior. This is the third one, chair warrior. Okay, put your arm like this. Lower your arm, straight. Straight out your arm, lower. Okay, upper your arm. Put your hand together above your head. Breathe in for 5 seconds. 1, 2, 3, 4, 5. Okay, lower your arm, breathe out. 1, 2, 3, 4, 5. One more time, student. Okay, above your head, breathe in. 1, 2, 3, 4, 5. Lower. 1, 2, 3, 4, 5. Very good, student. Someone is sleeping. The next one, eagle arm. Eagle arm. Sit straight. Sit straight. Okay. Straight your arm. Breathe in. Okay. And then bend your elbow. 90-degree angle. Bend. Breathe in. 1, 2, 3, 4, 5. And then straight your arm. Straight your arm. Breathe out. Okay. I forgot. One more time. One more time. Bend your elbow. Twist. Twist. Twist your arm. And put your hand like this.
Okay. Again. Okay. Okay. Try to stretch your arm first. Okay. And bend your arm. Okay. Move your right arm under your left arm like this. Okay. And try to stretch it. Try to hold. Everyone can do. If you cannot do as fast as you can. Okay. Try to hold your hand and then lift it up a little bit. Okay, and hold 5 seconds. Yes, breathe in and hold 5 seconds. Okay, 5. Okay, and load down. Okay, relax. Okay, and then back. Okay, like this. Okay, and then switch to another side and move your left arm under right and switch it. Try to. Okay, and then lift it up. Breathe in and try to hold it 5 seconds. 2, 4, 5. Okay, lower and then relax. Okay. This portion is difficult. That's for your flexibility. Just try to do it. Okay. Next one. Okay, the last one, that is a cat-cow stage. Okay, you sit on the chair and then your hand on your knee. Okay, and try to
Bow your back.
Okay.
Make it circle like this. Bow your back.
Okay.
Breathe in like.
Okay. And try. You can see that. Okay. Try to stretch it like this. Okay. Like a cat, right? Okay. And try to hold it 5 seconds. Okay. 1, 2, 3, 4, 5, and then stretch. Okay.
Stretch your back.
Okay.
Like a cow. Like a cow.
Right this. Place picture. Okay. Set. Okay. Okay, we try to do one more. Okay. The cat. Okay. Okay. One. Okay. 2. 5. Okay, and back. Okay, and stretch.
Stretch like a
Curl. Okay.
1, 2, 3, 4, 5.
Okay. Yes.
Finish.
That's just an example and everyone can do it by yourself. I think it's very easy for everyone and try to do it. That is good for your flexibility and everything. That the whole body and keep doing it.
May I ask the physical therapist, can you evaluate our students today? Can you score them from 10?
Okay.
10 out of 10, right?
Oh, over 10. Everyone just thank you for your attention. Okay.
Don't go too far. Of course, we now have Q&A. Dr. Parinya, if you could come back up, thank you. And do we have a spare mic, and we have a mic runner with long legs here. All right, so we're breaking new ground for the club today with exercises in the chair. Well, not quite as vigorous as when we had Alexandra here and we're all putting our hands up in the air. Put your hands up in the air. Put your hands. Remember that? Barry remembers that. He had his hands up in the air. Right, Q&A. I think Daryl had a question here.
As we age, it's natural that a calcium screen score goes higher. Can you give us an idea if you're 60 years old and you have a calcium score of this, you're in pretty good shape, 70 years old, can you kind of give us some benchmarks to talk about?
About calcium, most of calcium on the vessel is stay in in the plaque. It's like a component of the plaque. When you have a high, more plaque, many places scattered in heart artery, or sometimes a plaque volume is a lot. That's you have a higher calcium score. Score is calculated by the machine, CT scan machine. Yeah, and and from the study worldwide that it's related to age, but normally if you have too high, like over than 100, or extremely high, like over than 400, that's have that means it's correlated to amount of plaque volume in the vessel, and have most of these people have a higher risk to be a heart attack or stroke quicker than the other. And then about this now from the study, and it's changed the treatment, because now we know that calcium is correlated to the plaque. When you have a too high score, now worldwide recommend to control by the statin, and some people that age less than 70 and have a high score now recommend to take an aspirin, low dose aspirin, for prevent acute heart attack and stroke.
Thank you very much, Doctor. I just one quick one, and then another input. I know the albumin creatinine ratio. What's the U stand for?
You mean LDL ratio, all right?
Yeah, urine. Thank you. Sure, Ria. The other thing is, I had a 256 CAT scan, slice CAT scan of my heart done in Thailand a couple years ago, and it was over 1100. And the cardiologist there said, "You need a stent right now." I said, "No, I don't have medical coverage. I have VA in America." So I declined. But when I went home, I got the VA, and they sent and they did a angiogram. They sent a camera up my artery or vein to my heart. And the doctor said, no, you have some calcium buildup on the inside, but you don't need a stent. And my other cardiologist said that he treats 4-star generals and full admirals for many years in Washington, D.C. They have to have a calcium score every 6 months. And he said, based on their evidence, 50% of the calcium scores are high because the calcium buildup is on the outside of the artery and not on the inside. And it does not affect the blood flow at all. So unless you do an angiogram, you really don't know if you have a problem, is what my cardiologist said.
Good info.
Thank you. About this, because the vessel is like a tube, it's like like a pipe. Okay, when you have a plaque and calcium build up on the wall, it's like a effect by the vessel is like a bigger diameter is wider, and in some place that have a lot of plaque but not limit the flow because vessel is loss of elasticity and is bigger. About this is two things: the plaque and the symptom. Symptom have acute and chronic symptom. Acute is sometimes when you have plaque, but it's not too much block. But if the plaque caps is break out, it can be cause of deposit of the platelet and blood cell immediately and have acute, we call acute heart attack, acute stroke that's possible. But another is coming from chronic problem like it's progress of a plaque inside the lumen, and until the vessel cannot bigger than this and plaque is growth and it's narrow the lumen. The symptom is coming when you have an activity like when you walk 200 meters and you have a chest pain, cannot breathe, like that. That's a chronic symptom. When you have this together with the picture show the narrow of the lumen, okay, this you need stent. But if no symptom with a lot of plaque, you not need stent, but you need to control, okay, diet control, exercise and medication like that.
Yeah, I recently started going to gym, and I met quite a few people there at the gym who have taken stem cell treatment, injections. What are the side effects of it, and what are the success rates of it? Stem cells, yeah, stem cells.
You mean stem cell of the heart?
Yeah. Oh. Well, stem cell from the body.
Because stem cell, this for the heart condition, in some condition can use stem cell inject to the inside and make you have a new heart cell. But that's unpredictable when you inject like systemic. And now this is not proof that have a benefit, and it's not the one choice of the treatment for some people that not good heart function. And about stem cell, in this can use in some condition like when you have a chronic wound not healing. Certain doctor use stem cell inject, sometimes localize, sometimes like a systemic to make the wound have a newer cell to grow up quicker and heal the wound. This for the wound have a benefit, but for the heart now it's not proved the benefit and not one of a standard treatment.
This is a question I think probably most people here would like to ask, but they're probably a little bit too shy. And that is, if you've had a heart problem, so I'm asking this on behalf of a friend, If you've had a heart problem, how safe is it to take Viagra?
Because Viagra is effect is like a dilate the vessel. When the vessel is dilate, that means blood pressure is lower. Because inside your body estimate about the circulation volume is about 5 liters. When the vessel diameter bigger, that means the pressure inside is lower. And when you take normally when you normally when you take this, your doctor will warning you about nitroglycerin. But not only nitroglycerin, many medication that reduce blood pressure can be effect to like a synergistic effect to Viagra, and it make your blood pressure low, and sometimes you black out, collapse, or sometimes it make your blood flow to the major organ like your heart or your brain is lower and cause of the problem.
I recently saw a video on the internet, so you can take that for what it's worth. But they were talking about that modern medicine is putting too much emphasis on lowering cholesterol, that actually the brain in particular needs cholesterol, and that people lowering their cholesterol too much has been leading to problems such as Alzheimer's. Is that accurate, or is there other science that disproves that?
About this, because many people that worry about lower bad cholesterol, lower cholesterol is make a brain cell is damaged. But from the study, it's not show like that. Like 10 years ago, when the people have a stroke or heart attack, that's get LDL, bad cholesterol, lower than 100. After that, couple years later, the target is lower from the worldwide study, under 70, and now LDL in people that have heart attack or stroke already lower than 55. And in the condition of a brain, most of Alzheimer or dementia problem is coming from microcirculation of the brain, and that's coming from the small plaque in the brain by the high blood pressure, high sugar, high cholesterol. And about this now, when people that have Alzheimer and dementia, that MRI show about the effect problem of the microcirculation, brain doctor prescribe cholesterol medication to get LDL lower, the same like stroke.
Make us get some exercise.
Okay. I had an angiogram last year and it showed zero buildup in my arteries. Do you think it's necessary to take blood thinners? Because if there's no buildup, would that be a necessity, or should I not use blood thinners?
You mean angiogram not see the blockage, all right?
Yeah, there's no blockage at all.
Because angiogram, when you inject a contrast and take a picture, when you do this, you put the long catheter, inject a contrast agent, and take a picture, and you can see the track of the vessel. But the problem of angiogram sometimes it's like a irregular, or sometimes a small plaque, just only small plaque, but you cannot see the plaque on the vessel wall. It's different from CT scan. I think up to your if you done CT scan before and you see a lot of plaque, some place have a big plaque and angiogram not show the blockage, but you need to discuss with doctor that if your CT scan a lot of plaque, maybe your doctor advise you to take aspirin for prevent acute heart attack in the future. But many people that not do CT scan before angiogram, I think most of doctor see about the picture of angiogram. If a vessel so smooth, no blockage, this may be not recommend to take aspirin, especially when you older than 70 years old, because now before maybe 5 years before that, worldwide recommend to take aspirin for prevention. But after collect data, high percent, many people that age over than 70 have a bleeding in major organ, like in the brain or in the GI tract, and now not recommend for primary prevention, except that you have data that you have a lot of plaque or you have a heart attack or stroke before.
Something like Diovan.
Diabetes now too, because now new data that age over than 70 years old have only diabetes. No. Diovan. Diovan is a blood pressure medicine. Yeah, blood pressure medicine. If you Diovan or something in the same group use. Rivaroxaban. Rivaroxaban, because rivaroxaban is not like aspirin. It's a blood thinner. It's a effect to the factor, coagulation factor in the circulation, and used in many conditions, like when you have a venous thrombosis, lung embolism, arrhythmia, atrial fibrillation, to prevent blood clot that could be cause of a stroke. But if you don't have any condition or any risk that make you have a higher chance to be a heart problem or stroke, not recommend to take it because bleeding risk is too high.
Hello, Doctor. As we all know, we're not supposed to eat too much sugar and salt. Not sure the Thais realise that, as with their cooking, they do put a lot in. If you're perspiring a lot, and obviously you're not supposed to put salt, use too much salt, do you have a recommendation for a pill or something you should be taking for perspiration rather than sodium or salt? Yeah.
This about salt now, because have a lot of processed food and everything that mixed with the salt. When you read on the package, this may be 500, 1,000, sometimes 2,000 milligram of salt in one pack of sausage. That I think is only one pack is enough for all day. If you mix more, that means salt is overload in your body, and if you have hypertension, it make your blood pressure higher. If you have a kidney problem, it make your the workload for kidney more workload and make the worse of damage, injury to the kidney tissue. And if you have a heart failure, it make more water in circulation and make your heart failure condition worse.
Yeah, but rather than salt, I mean, you can buy low salt, right, which I use. But I mean, if you actually want to put salt in your cooking or something like that, is there a substitute?
I think if you cook yourself, you can put amount of salt. I think, especially normally about 1.5 to 2 gram a day. And you can see about this because every salt when that you mix is different. You need to read on the bottle that how many milligram of salt when you put for the 1 teaspoon, 2 teaspoon, like that.
Sure, yeah, I realise that. But I think a lot of the Thais, if you go to a restaurant, they just put a lot of salt and a lot of sugar in. I don't think they read the packs as to how much salt is in the food that they're cooking.
Oh no, I think we're really we're getting towards the end of the go. All right.
Thank you. Very interesting talk. A number of years ago, I was told to carry some aspirin with me so that if I ever did have a heart attack, I could be given the aspirin to reduce the damage to my heart. Is that correct?
About aspirin, when you never have a heart problem before, aspirin can prevent acute attack, because an acute attack is coming from a breakout of the plaque, both brain and heart. And when the plaque is break, it induces platelet and fibrin and blood cell accumulate deposit on that side and make like a block track of your artery. Aspirin direct effect to the platelet cell. It make it inhibit, stop the platelet that coming to this place and can prevent acute heart attack, acute stroke. But because information now, aspirin make a lot of bleeding in major organ, especially in the brain. And when older than 70 years old now, not recommend for prevention.
No, I'm not talking about prevention.
Yeah.
I'm talking about helping your heart after you've had a heart attack.
If you have heart attack, you need to continue whole life, because two things. If you put stent, aspirin and another one antiplatelet together in first year, is prevent about blockage by the blood cell at the stent. And after 1 year, you can stop second antiplatelet and continue only aspirin whole life for prevent new attack. The same place and the other place too.
This was actually following, I was in the middle of a game of snooker, and the person I was playing against had a heart attack and collapsed on the floor. The ambulance came to see to him and said, has anybody got any aspirin? Because they wanted to give him some aspirin straight away to help with the damage to the heart following the heart attack. So that's what I'm really talking about.
About this, because sometime when you have symptoms like a heart attack, like a chest pain, cannot breathe and collapse, sometimes not coming from the blockage of the heart artery. Sometimes it's coming from the aorta problem or the other problem like an arrhythmia. And if these people take aspirin immediately without something to confirm about heart attack, it may be cause of a more problem, like a more bleeding in aorta, that's a main artery, or maybe like a bleeding in other place.
Just a second. We have another doctor in the house, an Australian doctor, Dr. David. They have somewhat different protocols in Australia, do they?
No, I agree completely with everything that the doctor said, but in an acute setting, in emergency, we give 300 milligrams of aspirin just one time, straight up. And the thing is, if you're in the middle of nowhere, like I was been doctor in expedition medicine quite a bit as well, and like if you're halfway up the Himalayas and somebody has a heart attack and you're a long way from hospital particularly, then yeah, one aspirin is a good. There's evidence that it can help to ameliorate or make less severe an acute heart attack. Yeah, that's right. So it's one of the sort of standard medicines that you would have, but you only give one, like he's saying, that there's danger in taking it because there are other risk factors associated. But certainly, if someone comes in an emergency, even if they're older than 70, we give them 300 milligrams of aspirin as one of the first treatments.
Interestingly, I read an article, there's recent research come out where they're saying that if you are at risk for colon cancer, now there's a study came out that it can help mitigate your chances of taking a certain amount of aspirin can mitigate your chances of getting colon cancer. But you have to be at risk, of course. It has to be a family history. We've got a last question here.
Just a feedback on my calcium score. I'd heard that avocados can help reduce your calcium buildup. I started taking it for 2 months. I came back in the third month, same hospital, same machine. My calcium score went down 25%. So just another quick feedback. A doctor friend of mine in Texas, I asked him about 81 milligram aspirin because I have heart problems. His calcium score is 0, and he takes one full 325 aspirin a day.
I'm also wondering, we've got a doctor who wants to come in and give a talk about weight loss drugs like Ozempic and stuff like that. Is there any research coming out about Ozempic and weight loss and reducing heart attack possibilities? You know what I'm talking about, you know, the great Hollywood drug, right? Has anybody taken Ozempic here? So we have one person. Yeah, we'll probably have a talk on that soon. Any research about reducing chances of heart attack by reducing the weight with medication like Ozempic?
Yes. Because about reduce weight, it's improve metabolism of your body and less amount of fat deposit in your fat in your body and less chance to be forming of a plaque in the vessel. Many way you control diet yourself, like eat avocado, or not only avocado. I think a lot of diet that have a good fat that can be increase HDL, reduce LDL, reduce triglyceride, and but sometimes if you have like a overweight, obesity, and only your diet, your exercise not enough to get your body down. Now have a new medication that the pill and now injection, like once in a week, once in a 2 weeks, once in a month, that can reduce your weight. When you can reduce your weight, metabolism in fat metabolism in your body, and I think everything, blood pressure improve too. And when you weight down, you can do more activity, more exercise. That improve everything.
And talking about improving, Dr. Parinya has given us everything he possibly could to help us address our heart health and stuff, and Kana Kwam. So huge round of applause for the Dr. Parinya. Thank you so much. We have a very small token of our appreciation. I'll take that off you. And we have a thank you for Kana Kwam as well. Is she still here? My accent, no good. Coming down. Thank you so much to you and the rest of the staff for taking us through the exercises. I know many people need to go and have a massage now in Soi 6 after all that exercise. All right, come in. One more. One more for the. Oh, yeah. And the one thing I want you all to take away is if you go climbing Mount Everest, take some aspirin with you, okay? Oh, and the luck. Have you put in your feedback sheets in getting an influenza vaccine? Don't all put your hands up at once, okay? I know you're still stiff and tired from all that exercise. Who's interested in, if I say Shingrix vaccine, do you know what that is? Shingles, yeah. Who's had shingles here? I know some people have, and its pain is off the chart, right? If you've had chickenpox in your life, you've got a chance of getting shingles. Very, very painful. The Shingrix vaccine is 93% effective against it. Well worth thinking about. One more. Here we go. Here we go.
38, don't be late.
38, green. 38, green. Don't know. Oh, no, you got the one already. Yes. Oh, cool. Somebody's giving away vaccinations. Don't all mob him at once, okay? There you go, great. Who was the second one?
38.
No, he's giving one. We got 38 green. 38, don't be late. He's already late. This always works better in the other room for some reason.
Complicated.
You don't have you don't have fingernails. Oh, one off. 7, green 7. It's rigged. It's rigged.
Well deserved.
Wait.
Well deserved.
What?
I'll donate mine to someone who wants it.
What is it? What's the vaccine?
I don't know. It's a pack of condoms.
It's a. Are you kidding me? It's a cardiogram and echocardio. Oh, okay. Vaccine. What's a vaccine? Shingrix, is it?
I'll donate it to whoever wants it.
Okay. The Shingrix vaccine. That's a really good one to get. Okay. Okay. You'll be sorry if you ever get shingles, I tell you. Very painful. You like shingles vaccine? Yeah. You never know till it's too late to find out. 3 prizes. Oh, three free I want. Come on, I'll choose one. All right, here we go. I want number 6. 24. Lucky door 24. Okay, excellent. Another one. Oh, here we go. Mix them all up so I can't be accused. 36. 36. All right, cool. 36. 36. Is that you? No. It's a tough crowd here today. 5. Number 5. It's all around me. Oh, it's 6 and a 7 and a 5. Number 5. 5. The guy that went straight before me. 5. Yeah, you went straight before me, bastard. Brian, okay. One up there. And finally, 41. 4-1. You said it hopefully. 4-1. Lie about it. Get it. 4-1. Well, they don't check their things. They're frightened to get echograms. Just, I'm not going to count that one. I didn't mix up. It's too close to the old number. Okay, here we go. Don't all hold your breath. It's exciting. I'd like to say it was 6, but it's actually got a line under it. It's number 9. I could have said 6. I could have lied. Okay, well done. No, you're yellow. This is green. Don't worry about the colour. Okay, don't worry about the colour. So yeah, you'll get an echocardiogram, one of those electrocardiogram. And a round of applause for Kunjis and all the staff here and the great job they do coming here. Thank you so much. Thank you. All right, quickly, next week we're going to have a fascinating